Afternoon, everybody. Let's go ahead and get started. Um, Welcome to the Iowa Cancer Consortium's Capacity Building Series webinar entitled Public Health Collaboration. My name is Allie Bain, and I'm an outreach specialist for the consortium. If you would like to learn more about the ICC and its partners and programs, you can visit our website at www.canceroiowa.org. This webinar is one of a series of webinars meant to increase the knowledge among the ICC's members and partners. This webinar is being recorded and will be available on our website following today's presentation. So we hope that you enjoy today's content. So our first presenter is Janine Moody. Janine has served the Iowa Public Health Association since 2004, initially on the board of directors and now as the executive director. Prior to that, she worked as a community health consultant at the Iowa Department of Public Health and also as a planner for a nonprofit health system focused on geriatric community health. She is passionate about supporting the work of IPHA as a voice for public health in Iowa through advocacy, membership services, and partnerships. So welcome, Janine.
Thank you, Allie. Can you hear me all right?
Yep.
Okay, great. Thank you, and welcome to everybody who's joining us over the noon hour today. I'm really pleased to have been invited by the Iowa Cancer Consortium to speak to our partners who are members of the consortium. And I just want to give kudos to ICC. They are a fantastic partner for IPHA. They do a great job of sharing information and announcements with us that we can then funnel back out to our membership. So thanks to Allie for her work in coordinating this today. And I would like to begin. Allie shared with me that we might have folks on the webinar who don't necessarily work in public health as their day job. And so my job today to start the webinar out is to give you a sense of what public health is. And so I will share a sort of standard definition of public health. And Allie, I'm not seeing my slides anymore. Okay. All right. I'm guessing that it'll come up here in a minute. But public health is what we do as a society collectively to assure conditions in which people can be healthy. And public health matters to every Iowan every day. Public health happens where Iowans live, work, and play. From the moment you turned on the tap this morning to brush your teeth with fluoridated water, to the lunch you might eat at smoke-free and hopefully recently inspected restaurant this afternoon, to buckling your child into a car seat after school, public health touches every Iowan every day. I'd like to share a brief video which illustrates this point and which I think opens up the array of issues on which IPHA and the members of the Iowa Cancer Consortium might collaborate. So we'll go ahead and show that video now. Okay, thanks, Allie. And so just so all of you know, there is audio. Wow, it's a totally different experience to watch that video with the music that goes along with it. And I'll tell you that this video and another video I'll show later in my presentation are all housed on the home page of the IPHA website, which is iowapha.org. So you can take a look at that. I'll say that I've heard from some people they've used that video with Board of Health meetings or other presentations that they do. And if you're speaking to a group that really isn't that aware of what public health is, I find that a helpful video. So let's go ahead and move forward here. So the Iowa Public Health Association, we branded ourselves as the voice for public health in Iowa, and we have a very rich history and a vibrant future. We have been the voice for public health in Iowa since 1925. And so one of the things I think that's really pertinent for our discussion today is to note that our mission is to be the voice for public health in Iowa through advocacy, membership services, and partnerships. And so collaboration is what we're all about. Collaborating with our partners is foundational to our work and all of our successes. We're a small nonprofit and we have a statewide reach, but we really amplify our voice through our collaboration with our partners. And just a snapshot of who we are comprised of diverse public health professionals who work in diverse settings across the state. So we have epidemiologists, we have nurses, we have dentists, we have dental hygienists, we have community health educators, we have physicians, we have laboratorians. We really have across the gamut of different disciplines within our Public Health Association, but also in different work settings. So we have a good percentage of our membership that works at the local public health level in our county health departments, and then we have a large number of members who work at the state health department or at the university level. And then we have a number of nonprofit organizations who are agency members of our association because the work that they do related to health advocacy intersects so nicely with what we do in public health. And so some things that we do, we connect and convene. I can't tell you how much of what I do that I know is a benefit to our members. It's just connecting them. I frequently get emails or phone calls from people who say, hey, Janine, do you know anybody who's worked on this issue? Or I'm going to be in Worth County and I'd like to connect with a local public health person there. So really a lot of the value that we bring to these collaborations is just helping to make the connections. And you can see the second bullet there about cultivating partnerships. As I said, it's just foundational to what we do. We frequently get credit for being a much bigger, more impressive organization that we really are on paper, and that's really thanks to our collaboration and our partnerships across the state and outside of our state. We have key collaborations within our HRSA region with Missouri, Iowa, Nebraska, Kansas, and also at the federal level. A lot of the advocacy work that we do at the federal level is closely linked to other organizations, including the American Public Health Association, but other health advocacy groups at the national level as well. We do this by engaging our members. We advocate for public health. We help with professional development through education of our workforce. And then a couple of upcoming events for you to maybe put on your calendar are the Iowa Governor's Conference on Public Health and a meeting that we will be hosting in May in Iowa City, which is a Region 7 meeting of the APHA affiliates from Missouri, Iowa, Nebraska, and Kansas. The information on that is on our website as well. And then a really key part of what we do is mentoring and promoting career development. And that might be new MPH grads who are just out of school, but a lot of times, and we're seeing more of this with the turnover in our public health workforce, we've had a lot of retirements of really seasoned veteran public health leaders in the state, and we have a new cohort coming in to leadership roles in public health who might not be new to public health or new, but they are new to their position and they need some mentoring and support. And again, the collaborations are a very key part of that. And I just wanted to give you a snapshot of partners. And this is truly just a a small representation of the key partners that we have within our association who help us do what it is that we're able to do via collaboration. I keep a folder on my computer that's titled Partners. And at a recent board meeting, one of my board members said, can you just list off all of our partners? So I opened my partners folder, and then I pulled up about 60 subfolders under that with names of different entities and organizations. And one of them, for instance, was the Iowa Department of Public Health, but under that folder were many, many more folders related to different divisions and bureaus and programs. So we really do walk the walk. We talk about collaboration and partners. They're just pivotal to everything that we do. Okay, so one of the things that Allie asked me to sort of set the stage for the presentations that Tammy and Barbara will be giving about collaboration and what that looks like in their communities, she asked if I would sort of give the state of public health in Iowa. And that could be a very long presentation in and of itself. So what I thought I would focus on here, because this is the Iowa Cancer Consortium, I thought it might be helpful to just focus on the cost of chronic disease in Iowa and how we're doing as a state. So if you go to the Centers for Disease Control website and put in State of Iowa profiles, you can pull up a lot of data about specific indicators related to each of these categories. However, I want to sort of give a snapshot of where we are and how we're investing in public health and prevention and what that means for Iowa. And the financial investment in public health in Iowa is a mere $58.26 per capita. And of that, $17.46 comes from the state of Iowa, and an additional $40.80 per person comes from federal funding from CDC and HRSA, which is the Health Resources and Services Administration. In 2009, Iowa healthcare spending per capita was $6,921, higher than the U.S. average. And yet, what are we getting in return for these expenditures? I think that's an appropriate question to ask ourselves. Currently, more than 60% of Iowans are overweight or obese, and obesity-related programs cost Iowans $783 million annually. Only 46% of Iowan adults get enough physical activity, and only 20% consume enough fruits and vegetables. Each taxpayer, regardless of personal health, pays an extra $177 a year just to cover the medical costs caused by obesity. Collectively, we spend 3 of every 4 healthcare dollars treating chronic diseases. And that's here in Iowa, but also nationally. Over the next few decades, life expectancy for the average American could decline by up to 5 years unless aggressive efforts are made to slow rising rates of obesity. Cutting the lives of our kids short by not valuing prevention is not acceptable, and we can and must do better. I'm guessing that a number of you might have been at the ICC Summit in October, where I gave a presentation dedicated simply to the toll of tobacco in Iowa. So I've chosen to focus on obesity and how it relates to these health indicators for giving sort of the lay of the land today. But I'm always happy to talk about tobacco control issues and the toll that has on Iowa. So how can we do better? And I think one of the key answers to that is collaboration. So IPHA is working with state leaders and urging them to commit to opportunities for changing the collective responsibility for health in Iowa by rethinking our built environments and creating community-level and statewide policies which value and invest in health promotion and prevention. For example, shared use policies for schools to offer community access to gyms. We didn't get a win on that one in the legislature this session, but it was our second go at it, and that's something we'll continue to work at. Setting nutritional guidelines for state agency food procurement. And that's something we're waiting for the governor to issue an executive order on that particular piece. Conducting health impact assessments for planning and zoning. And I have to give a shout out. I see that on the webinar today is Denise Attard-Sacco. And Denise is a fantastic IPHA member volunteer who has a great deal of expertise on health impact assessments. And so I would urge you to go to the IPHA website and take a look at the work that she's put out there outlining what health impact assessments are and how they can be used. And collaboration is a key component of the health impact assessment process. IPHA seeks opportunities for public health and other governmental entities to identify and leverage non-traditional partners across sectors and within the business community to advance this new thinking. We cannot abdicate the governmental roles of public health to protect and respond to traditional public health threats such as disease outbreaks. Still, we recognize the potential power of engaging all Iowans through collaboration to achieve a better public health in Iowa. So what are some of the opportunities for collaboration? For us, it's all about leveraging those partnerships. You can see the picture down there in the bottom right-hand corner is from our most recent 2014 Public Health Day on the Hill, and that is a collaborative effort. It's not just IPHA, it's also the Iowa Counties Public Health Association, the Iowa Environmental Health Association, the State Hygienic Laboratory at the University of Iowa, and the University of Iowa College of Public Health, who all partner to bring some visibility to public health during that day on the Hill. Coming up, I already mentioned our Governor's Conference on Public Health. That's a great opportunity to meet people who are interested in some of the issues that you're working on and network across the state. There are usually about 600 people in attendance at the Governor's Conference on Public Health, and this year it will be April 1st and 2nd, and registration is available via our website. And even doing the conference is a fantastic case study of collaboration. While IPHA serves as the fiscal agent and we co-chair the planning committee along with the Iowa Environmental Health Association, there is a diverse group of partners who actually serve on the planning committee and work to pull that conference together. It's a truly organic example of collaboration in Iowa. Also, I mentioned our Region 7 meeting, which will be happening in May in Coralville in Iowa City. Our IPHA Advocacy Forum is another fantastic example of collaboration. We do that each fall, either November or December in Ankeny typically, and we bring together diverse groups, our members, but also other organizations to sort of set forth what their legislative platform for the upcoming session will be. And that includes presentations from the executive branch and the legislative branch. But really, again, walking the walk about valuing collaboration, we have implemented a period of time at the beginning of the advocacy forum where we have sort of what we call open mic time, and we pass the microphone around the room and we invite everybody to stand up, say what organization they're with, and what their legislative priorities are. So it's sort of a 30 to 60 second commercial for all these other organizations. And it's a great way to identify where the synergies are and how to collaborate specifically in that case on advocacy issues. And then finally our Public Health Day on the Hill, which I referenced earlier. And finally, I just need to say, I love this picture. It makes the case that public health really is in your hands, and it's in all of our hands, and that your voice matters in public health. And I have a video here. Allie, I think if I click on it, I can go ahead and, or she'll take care of that. So hopefully we'll have some audio to this one. Okay, thank you. Thank you for your time, and Allie, I'll turn it back over to you now.
All right, thank you very much, Janine. Our next presenter is Barbara Chadwick. Barbara is the Clinical Services Division Manager at Lynn County Public Health and has served there for 3 years. Barbara holds several advanced degrees and certifications in professional nursing, program evaluation certification, and is a legal nurse consultant. So Barbara, I will hand it over to you.
Thank you very much, Allie, and thanks to all of you for letting me participate in this event here. What I wanted to do just very shortly is talk about many of the things that Janine talked about. Can everyone hear me?
Yep.
Okay, is to talk about many of the things that Janine had highlighted at a very high level and bring it down to an urban public health county and some of the collaborative partnership initiatives that we have surrounding chronic disease and cancer. Arrow. First, just really quick, who are we? I have our mission statement and our vision statement here, and also the link to our very new website for the county. And the /health will get you to the Public Health Department website where all of these initiatives and much, much more are there for follow-up contacts, discussions with individuals who are involved with our various collaboratives and partnerships, and anyone would be, honored to provide you with some guidance and input. Lynn County, just at a glance, for those of you that aren't familiar with Lynn County, we have 21 towns and cities in our county. The largest city is certainly Cedar Rapids, which is 60% of Lynn County population. So that's the emphasis of our work is here in Cedar Rapids.
So they know our schedule and when the dates and stuff, so they can put it on their calendar. We'll send them out.
This here is just kind of a reminder. I mean, I'm sure that we've all seen this before, but it's public health systems and all of those pieces that contribute to what we do in public health. So these are all potential partners, et cetera, including, and they're not here in this wheel, but certainly I would add our funders, media, certainly partners when we're looking at community events and initiatives, is to include those folks at the table. And then I want to take a look at the initiatives that we have going on here at Lynn County and tying those back into, what is public health and what's our role? What can we bring to the table in various capacities? The inner circle is certainly the 10 essential services, and that's the what do we do, the work that we do. The outside circle are the 3 core functions that talk about our roles. Our role of public health in assessment, policy development, and assurance. So these are the 3 core functions that I'll be referencing throughout my presentation. And depending on the initiative and the role that we have at the table, will determine the function that is being activated or is priority at that time. The 6 initiatives that I would like to kind of highlight for everyone is our work with cervical cancer, breast cancer, colorectal cancer, lung cancer, asthma is a chronic disease, and obesity is a chronic disease. We have many initiatives going on here at the health department, but these are the 6 that I would like to bring to your attention. We do have an Office of Chronic Disease Management, and the focus of that branch, if you will, is to focus on the care for yourself, the cervical and breast cancer screening, the Iowa Get Screened, the colorectal screening cancer, and the Wise Woman programs. Now, we know the Wise Woman program is no longer available, but many of those lifestyle high-risk factors for chronic disease, we're continuing them, those activities. The goal for the chronic disease management office is to screen, which is assessment, and bridge individuals for access to care. The key stakeholders that are part of this initiative are hospitals, our outpatient services for screenings, for diagnostics. We do screening, we don't do diagnostics, but we need to get folks plugged in to those systems, private physicians, clinics, et cetera. We have over 30 partners that are involved some way in all of these programs throughout the continuum of care. And then we also offer a community-wide osteoporosis screening program with another, actually a funder, and that would be United Way here in Lynn County. Our cervical cancer specifically, this year, currently as we speak, we have a new prevention initiative that is actually bridging two of our divisions or branches, chronic disease, as well as our immunization services program. And we're doing a community-wide education campaign regarding HPV immunization for cervical cancer prevention. I know there are other county health departments that are doing the same initiative across the state, and that's really exciting. In our local partnership, we have a Lynn County Immunization Coalition, and that link is down below here. We have 25 plus collaborating partners, including media, pharmaceutical vendors, retired nurses who want to participate, and we'll be doing assessment, outreach, education, and actually taking the vaccines out on the road. And I do have the website for our Immunization Coalition that is almost ready to be launched, but we do have an email site as well for further contact information and so forth. So I urge you to check out the LynnCountyImmunization.org here just shortly. The breast and cervical cancer initiatives are just a little historical perspective. Those are not new initiatives in Lynn County, but actually for over 20 years, it has been part of the community collaboration effort. 20-some years ago, there were 4 key partners who got together and said, you know, we need to address this in our community. We have many uninsured, underinsured women that are falling through the cracks, and what can we do about it? The Healthy Lynn Care Network was formed, and 4 founding entities collaborated for about 18 years or so to keep this project going. Not only did they engage in breast and cervical cancer, but also access to care and so on. In 2010, for sustainability reasons and also looking at affordable care, et cetera, coming down the road, the Healthy Lynn Care Network was disbanded, but all of those programs that were up and going were adopted by one of these partner entities. And so we can see the fruit of this work continuing. And at Lynn County Public Health, it's our Office of Chronic Disease Management that adopted the breast and cervical cancer programs, as well as the colorectal cancer screening program that we have, the IGS. And we've been doing this, I believe, for 2 to 3 years. And there's a website here from IDPH, and again, we do a lot of screening and referral for diagnostics. Great partnerships with the physician community. We have several initiatives going on that are addressing lung cancer prevention efforts, 2 in particular. One is currently very active, and that's our radon collaborations, our internal partners here within the health department, where we have Healthy Homes branch, that is leading our efforts in radon, testing, mitigation, policy development, etc. They've been very active with 60-some partners, landlords, business, city government, consumers, coming to the table and looking at radon in residential housing. And then most recently, within this last year, with the support of ICC, we received a small grant to help launch a community-wide education effort looking at the link between radon and lung cancer. And it was extremely well received. One evening, we had it open to the public with 100 and some consumers, family members, individuals affected by radon. And then the next evening, same presentation, but tweaked a little bit, geared to healthcare professionals, and that was well attended as well. And Ruby Perrin and her group are continuing with radon efforts out to testing in the schools. There's a partnership going on there, as well as more engagement with our medical community looking at radon testing being a question that's integrated into the history of individuals coming in for a well check in the physician's office. You know, when was your last TB test? Have you had your water tested? Have you had radon tested in your home? And integrating that into just the standard protocol, which is a major coup. Another huge effort, though, of course, that we had was our environmental tobacco, smoke, our CTG grant, Smoke-Free Housing Initiative, which is a partner with ASAC here in our community. It's a wonderful, successful program. And prior to this, we had a CPPW 2-year grant also addressing tobacco smoke, dissolvable and smokeless tobacco efforts. And again, here are some, is a link to the Lynn County Home Health, or Healthy Homes branch to kind of get some more information about these initiatives. A little plug for our successful education event that we had last fall. This is our little logo that went out, and individuals were still seeing this logo out and about in the community. In looking at radon, one of the things that we do bring to the table in these coalitions and partnerships is data. Public health has a lot of data, or the capacity for a lot of data, and we like to share that to help with the decision making and the discussion and kind of helping that to move forward. And this is one of the GIS maps that was put together to kind of depict the average radon by zip code. So it's of our county and where we have the highest levels of radon. This data represents 1990 through 2013. Over 12,000 kits have been analyzed that we've dispensed through the Public Health Department. We're thinking that the areas that we don't see a lot of testing, it's just underserved, and we need to get the education and the testing out into those communities, those neighborhoods. Chronic disease and asthma is another effort from the Healthy Homes branch. We are the recipient of a CHAMP grant, which is looking at as home asthma management program, identifying the children and adults that we see through this program are by referral, so we don't go out shaking the bushes other than to providers and emergency rooms and so forth, that we are here as a resource. Let's keep individuals out of the ER for those syndromic respiratory symptoms that may be asthma related. And if we correlate that to our, air quality and so forth, that's a pretty good case for identifying those folks and getting them into the system. And what this grant and program does is we go into the home to do a home assessment, trying to identify those triggers that may or may not be contributing to the asthma exacerbations. Key partners certainly are physician referrals, including emergency rooms and other community organizations where these folks are seen, urgent care settings, and so on. This model depicts the care that a person with asthma really, all of these areas need to be connected for good case management. They need access to care, appropriate medication, self-management, and certainly an environmental assessment. Without that environmental assessment, we see folks with asthma being frequent flyers through urgent care and emergency rooms and so forth. So great opportunities here with this program, identifying other community partners to work with on this. We're hoping that by having a project focusing in on asthma, that it can expand to other community collaborations, perhaps around COPD, moving into an older population of folks. Needless to say, we need to also talk about chronic disease and obesity, the obesity leading to a lot of chronic disease. And currently we have a couple of projects. One is that we have partnered with the Lynn County Food Systems Council, as well as the Blue Zones. So both of those entities have a number of partners that we're collaborating with to do a food systems assessment, identifying the issues, and then implementing plans to engaging community neighborhoods into the access to healthy foods. And also with the Blue Zones project, we've got the food system piece, but then we need the physical activity piece, and looking at complete streets and bikeability and walkability and all of those things, getting individuals up off their seats and out there burning some of those calories in a safe and supportive community environment. Also related to the chronic disease and obesity, I had mentioned that the Wise Woman program, as we know it, is history, but many of those elements in that program, looking at lipids and A1Cs and blood pressure and BMI and so forth, we continue to do that, but we do refer to other partners. We'll do the identification, the assessment, the screening, and then get them plugged into a medical home, chronic disease self-management programs that both of our local hospitals have, and we try to ensure that those individuals get in there. And then we follow up with them to make sure that they were able to make contact and follow through. In summary, the core functions of public health: assessment, policy development, assurance, which is access to care, we do those. And we always try to tie them back when we have an opportunity. I don't know about anyone else, but we have lots of opportunity to join a group and so forth, but with our limited resource and our capacity, you hate to say no, but we need to always think and bring it back to what is public health, and can we do, and does it tie into our core functions? I'd like to say yes, but there's only so much of us to go around. Of all of these initiatives, if we were to summarize, what's common, these are successful collaborations and partnerships. Certainly, key to the whole success is good data. We need to have good data to drive those decisions and to get community buy-in, so that this isn't the public health show, that this is the community show. This is the community effort, and we can provide that data through assessment and surveillance for the decision making, and also having data that measures the outcomes and drives the performance indicators. How well did we do? What do we need to do differently? Those outcomes and indicators are identified right at the outset of the initiative. How will we know when we're successful, or if we need to change something up? And that becomes the community partnership discussions around that data. And another commonality is in each of these initiatives, as I alluded to, is, who do we invite to the table, whether we're being invited to the table as a participant or we're sending the invite, is who needs to be at the table, and what is public health contribution to the table. It might be a facilitator, a key driver, a support and consultant. We'll give you data. Whatever our role is, that it's appropriate and that we have the capacity to deliver. So if those things are clear and in place, then hopefully we'll have some successful partnerships and initiatives. And I think I'm about done.
All right. Thank you very much, Barbara. Just a reminder, if you guys do have questions, you can feel free to type them in the chat tool, and we will get to them after our final presenter. So our final presenter is Tammy Moore. Tammy Moore has worked at Calhoun County Public Health for 23 years and has a background in nursing, working in home care, hospice, and public health. She received her BSN from Briar Cliff College and her master's in public health from Des Moines University. Tammy's current position is the public health coordinator. All right, Tammy.
Thanks, Sally. As Barbara spoke of public health collaborations in an urban perspective, I'm going to speak of public health collaborations in a rural perspective. Calhoun County is in northwest Iowa. We're about 100 miles northwest of Des Moines. And our mission is, Calhoun County's public health mission is to partner with the community to provide quality public health services in our county. And when I look at that and think about our topic of the presentation today, collaboration, the word partner jumps out to me. We're looking to collaborate and partner with others. We're not doing this alone. We need other partners to serve our community the best we can. We're definitely a rural population. The total population of our county is under 10,000, and we have a high percentage of our population that are 65 and older. We do not have a lot of diversity in our county regarding race, but we see diversity even in our poverty level is high at 11.4%. One thing that we're not proud of, but it's something that we face, is that our death rate exceeds our birth rate. So we are definitely an aging population in our county. We are made up of multiple small rural farming communities. So when I think of guidance, the guidance that we use at Calhoun County Public Health, while Barbara spoke of the 3 core functions and 10 essential services of public health, we see all of those included in the Iowa Public Health Standards. But at Calhoun County Public Health, we use the public health standards as a guidance. There are 11 standards. 6 of them are, I'll just kind of list those quickly. They're governance, administration, communication and information technology, workforce, community assessment and planning, and evaluation. And I think of those as more administrative type standards. And then there are 5 standards of public health, and those are prevent epidemics and the spread of disease, protect against environmental hazards, prevent injuries, promote healthy behaviors, and prepare for, respond to, and recover from public health emergencies. So all of the services that we provide through Calhoun County Public Health, we try to align with, or they definitely do align with, the public health standards. And we use those as a guide. We don't want to reinvent the wheel. Our resources are short, and so we want to use those services and tools that are out there for us. We use our community health needs assessment and our health improvement plan as a guide for us in our agency. Our grants that are associated with provided services or gaps that we've identified are definitely something that guide us. As resources are limited, resources are time and money and people, we look for gaps that we've identified, and we try and seek out gaps, grants that would provide funding and fill those gaps. And we definitely depend on our Board of Health and our Board of Supervisor for guidance. We do feel that many times the collaboration that we have, through the collaboration, we may be eligible for more grants or more funding if we collaborate with others. So many times we partner with other public health agencies in our area. We feel like we have a greater opportunity to receive grant funds and that we can reach a greater number of people and do more, maybe do more with less. Um, and at Calhoun County Public Health, we really feel that we feel that we serve as a gap filler. We use our community health needs assessment to help us identify service gaps, and then we look to provide services that fill those gaps we've identified. We partner with a multitude of agencies and collaborate when we complete our community health needs assessment, and we try to avoid duplication. If there are others that are providing a service or meeting a need, we look to the gaps and try and fill those gaps. Thinking of partnerships, and there's no way we could list all of our partnerships, and like the ladies before me today spoke of partnerships, we have partnerships on many levels, both federal, state, and local levels. And some of the federal partners that we feel we have, we think of them as partners as the National Association of City and County Health Officials. They are an excellent resource, and we use a lot of their information as guidance for where we go to the future and the services we provide. We feel like we have federal partners as grants funnel down from federal sources. And many times we'll use the CDC or the Center for Disease Control and Prevention. We think of them as a partner. We look to them for information and guidance for what we do. There's a lot of state partners, and we depend on them and communicate with people on usually a daily basis about one thing or another, or some of our grants are coming from those sources. I really appreciate what I believe Janine spoke about with all of her partners, and she opened a document at a Board of Health meeting. And again, I would agree with her. We have multiple partners within the Iowa Department of Public Health that we use. Some of our local partners that I've listed and we deal with on a day-to-day basis with different projects and programs, schools and school nurses, faith-based organizations, extension offices. I'm not going to read all of them for you. You can do that. They're there on the slide. But we feel like this list grows all the time, and we depend on those partnerships and those collaborations more and more. Sometimes we identify new partnerships and new people that we collaborate with based on a gap that's been identified. We started partnering in November of 2011, a more formal partnership with our local hospital. We had, I would say, an informal partnership with them before that time, but this came about at a time when hospitals were required to complete a community health needs assessment, and they were required to do their needs assessment every 3 years, and public health, we do ours every 5 years, our last one being in 2011. And so we partnered and worked on sharing information and data. We viewed and used a National Association of City and County Health Officials webinar that was titled Performance Improvement Technical Assistance Webinar, and it was strategies for local health department and hospital collaboration. So we really used that as kind of a way to begin networking. It provided great information for us, and we looked at more ways that we could collaborate. We continue to meet. Many times throughout the years we have met monthly. Sometimes we meet quarterly. Kind of depends on what each one of us has going on and needs the most immediate attention. But initially we met monthly, and now we meet at least quarterly, sometimes more often. Looking for gaps, who's doing what. Public health tries to serve as a resource for the health coaches and coordinators that they have at our local hospital. So we're just looking to share information all the time. One example of a partnership and those public health standards we have is we really look to our schools as partners through the school nurses and the staff at the schools. But just some of the ways that we have partnered with the schools is we practice injury prevention messages with the schools. We hold bike rodeos and bike safety information for all the first graders in the county, and then all the first graders go home that day with a bike helmet. Under the public health standard, public health behaviors, we have gone to the schools and provided a lot of different messages. Cancer prevention messages such as sun safety. We relate that to tanning. We do share some information at prom time because of all the kids that are tanning and in tanning beds. We have provided tobacco prevention classes, and those services are provided and linked to another grant that we have, the Tobacco Prevention Grant. And I have done presentations for like all of the health classes, and we talk about cancer prevention. Of course, included in that is the sun exposure, tobacco, but also diet and nutrition. We feel like it's a good thing to expose the kids to, and will keep them healthy in lots of aspects of their life and prevent those chronic diseases. Under Prevent Epidemics, we go into the schools and provide immunizations. And under the public health standard, Protect Against Environmental Hazards, we have done radon testing in all of the rooms in the schools in our district. And that's something that we just recently did this year. And that was kind of exciting to complete. But you can see we partner with a lot of different people on a lot of different levels, both public and private partnerships. We value all of them, and collaboration is certainly the key to that. Just one area, a project of interest that we completed and wrapped up actually last year was an enhancing cancer control in Iowa. I served as a community health assistant, or excuse me, just a community assistant in Northwest Iowa. There were 5 community assistants in Iowa, and this was a project that partnered through the University of Iowa and the Iowa Cancer Consortium. And we conducted regional forums. Each one of the community assistants conducted regional forums in their region, and we had the goal that we wanted to learn more about issues related to cancer control from a community perspective. So we wanted to know what was going on in the communities. What did they know about cancer? What questions did they have about cancer? What were their thoughts? Where were they getting their education or their information, or what did they think they needed? And following the 3-year project, there were 20 community forums that were held across Iowa, and 146 participants attended these forums across the state. Like I said, that was a 3-year project, and it was a wonderful collaboration and partnership. We tried to spread the information about that the University of Iowa has available, and ways that even people in the far northwest corner of Iowa can partner and learn things from the University of Iowa, that they're here to serve everyone in the state. So that was a great project. The first year we focused specifically on colorectal cancer. We were looking at the colorectal cancer rates in Iowa, and the fact that over half of Iowans age 50 and older had not been screened. So we're really trying to raise awareness about colorectal cancer. We shared cancer maps so that people could look at cancer incidence and mortality in their specific areas. Many times they would, maps were very interactive. People would find their area on the map and look at, why are our rates so high, or what are we doing different, or why are so many people dying of this? So it sparked a lot of conversation. But that was year 1, and then year 2 and 3 of the grant, we spent more time just evolving and sharing more information about cancer prevention in a variety of areas, such as skin cancer, HPV, radon, tobacco. We talked about viruses and vaccines, physical activity, nutrition, screening, and obesity. And that was a great project to be involved with, and we certainly collaborated in a different level because for me, instead of working in one county, we had 24 counties in northwest Iowa that we covered. The reason that that project seemed so important to us at Calhoun County Public Health was it fit perfectly with what we were doing in our county. We had to assume some additional responsibilities and go to other places, but it was a perfect fit for what we were already doing, and it allowed us to provide services in our county also. I think about best practices. We try and implement best practices always at our public health agency. It's the best use of our resources. Staff and time are limited. I'm sure everybody faces the same things. We see a need to invest in programs that will work and have an impact. You know, we don't want to invest our time and money in trials or things that aren't working, but we want to do what's tried and true. Evidence informs decisions throughout the planning process, so we want to be able to refer back to that evidence-based. There are lots of resources and tools available, and many times we use the CDC website that's listed here to look for guidance and evidence-based practices. While we're collaborating and in the work we do, we're always trying to look at evaluation or keep quality improvement in our mind. Quality improvement is very important, and we're working on quality improvement all the time. Our goal is really to build quality improvement and best practices into all we do, trying to get all of our staff to look at quality improvement on a day-to-day basis, kind of breaking it down and keeping it very simple. Always asking, when you finish something, maybe it's a project or a presentation or even after an agency meeting, ask, how did that go? What could be done differently? What needs changed? Doesn't have to be a real lengthy process. Sometimes it might be, but not always. And so it's important to ask those people you collaborate with, whether it's within your own agency or other groups or organizations, how are things going? What was successful? What's worked? What do we need to change? We feel like it's always important to be flexible and be open to new partnerships. Through our needs assessments, sometimes we determine that our needs have changed in our county. What we maybe saw as a gap in the past is no longer a gap and it's duplicative. And so sometimes you need to be okay to let something go and step away from a service or a project and start something new or different. We feel like we need to be very flexible. The Affordable Care Act could change many things that we do, who's providing services or who's doing what. The breast and cervical cancer program helps fund, like I spoke about earlier, it helps fund mammograms and pap smears for women, funds an office visit. If everyone is insured, will that still be a need that we have? We assume there'll always be a need for awareness, but we're just always looking at how things are going to change and being open to new partnerships and flexible and how we can meet our needs and plan for the future. In public health, the sustainability is always a big thing, and we're always looking at, if we do get grants, how can we sustain this program and, carry on and continue to meet the needs that we have. Let's see. And I think that's all I have for you now. Thank you.
All right. Well, thank you very much, Tammy, and thank you to all of our presenters. We are running short on time, so as Tammy mentioned, evaluation is very important to us, so we do have an evaluation for you all to take today so we can plan our future capacity building series webinars based on your feedback. So you should all be receiving a SurveyMonkey evaluation in your browser. If you could please fill that out, we would greatly appreciate it. And if anybody has any quick questions, please feel free to type them into the chat tool. All right, I think you guys did a fabulous job. And like I mentioned at the beginning, the slides and the recording of the webinar will be available on our website, and we will send that out to everybody once it is uploaded. Looks like we might have had one person typing. All right, well, if there are no questions, thank you all very, very much. Thanks again to our presenters, and I hope you guys enjoy the rest of your afternoon.
Thank you.
Thank you.